Hello, my name is Dr. Patricia Mars, and I'm discussing an article entitled Needle Microcores, Can They Pose an Occlusive Threat with Nonparticulate Injections by Soares et al. The incidence of vascular occlusions for cosmetic injections has risen substantially due to the popularity of injectable fillers and botulinum toxins. The cause of the soft tissue ischemic events for particulate injectables is well known, as the particles of filler can be injected into vessels and cause arterial blockade. This can result in skin necrosis, blindness, and stroke. However, the cause of non-particulate injections causing ischemia is less understood. The authors designed a study with the hypothesis that the mechanism of injury for non-particulate injections is the accidental capture and intravascular injection of needle microcores. These are defined as sub-millimeter tissue fragments that are trapped by the beveled lumen of a needle during conventional injections. To test this hypothesis, they evaluated dermal remnants incidentally captured by 31-gauge tuberculin needles that had been repeatedly injected into post-facelift skin fragments. The insulin syringe was pre-filled with a buffered cell wash solution. 200 syringes were used in two different experiments, either injection into skin or injection into a rubber cap. The needle was poked through the skin up to 50 times, and the needle tip was expelled at certain times and collected into vials for cell analysis. In their study, the authors found the presence of dermal tissue microcores ranging from 100 to 275 microns in diameter in 4 of the 7 samples, with an overall incidence of 0.7%. These microcores are in the diameter of most facial arteries. No cores were seen in fresh needles or extremely dulled needles. The authors confirmed that a small gauge needle can produce microcores and therefore cause vascular occlusion, although this incidence may be very low considering the millions of botulinum toxin injections that are performed each year in the United States. I found this study well thought out, and it gives insight into a possible cause for vascular injury in patients receiving non-particulate injections such as botulinum toxin. And it's also a possible way to avoid this kind of complication, perhaps by using fresh needles. The authors do note the limitations of the study with the small sample size, and only one type of needle was used. Thank you.